Hello guys. So today we shall be discussing some of the skin infections in the children, right? So the first of all we shall start on with a particular type of skin infection, and all of you know that. So first of all we shall be discussing some pigmented lesions, right? So in these three pictures which you can see here, there are pigments on the skin, right? So they are different from each other. One is, let us say, gray or hyperpigmented, one is bluish, one is black, right? So what are these pigmented lesions we shall be seeing? So we shall focus on a topic that is common pigmented lesions. Common pigmented lesions in childhood, right? So we shall be mainly focusing on common pigmented lesions in childhood. So the first important thing, these spots are called as café-au-lait spots, right? So they're pronounced as café-au-lait spots. And how do I write it? C-A-F-E, café-au-lait, café-au-lait spots, right? So I'll be discussing in detail regarding them as well, right? Let us just name these spots over here. Now the second important thing which you can see here, the bluish patches, right? These bluish grayish patch which you can see, most commonly you see this on the lower back, on the back side, okay, in the newborn individuals, and these are called as Mongolian spots. Okay, so these are called as Mongolian spots. Mongolian spot, or the other name which you can give for this is congenital dermal melanocytosis. Congenital dermal melanocytosis. Congenital dermal melanocytosis, right? And the last one, whatever you can see here, so this is called as congenital melanocytic nevus. Congenital melanocytic nevus, right? So these are three important things which you definitely have to know. These are the very important three things, right? One is café-au-lait spots, and next you have got the Mongolian spots, and the last one, that is congenital melanocytic nevus. So these are the three important things which you need to know. So these are the basic common pigmented lesions which you see in the childhood. Now our main focus will be on these congenital dermal melanocytosis as well as congenital melanocytic nevus. Okay. Now before I discuss in detail about that, I just want to write few points regarding these café-au-lait spots. All of you know, if you look at these café-au-lait spots, how are they, guys? Café-au-lait spots are, they are elevated or they are flat? Obviously they look flat, right? And they are hypopigmented or hyperpigmented? Obviously when you compare with the surrounding skin, these spots are hyperpigmented. And these spots, café-au-lait spots, these are most commonly seen or most commonly associated with a condition called neurofibromatosis. Okay, so what I was telling you is that the first important thing is they are flat. Not only flat, they are hyperpigmented. Second important thing is that these spots are associated with a condition called as neurofibromatosis. Okay, and another condition also, that is McCune-Albright syndrome, right? But anyways, neurofibromatosis is most important. So these café-au-lait spots are flat, hyperpigmented, and they are associated with a condition called neurofibromatosis. Now let us discuss about this congenital dermal melanocytosis. What is this congenital dermal melanocytosis? Now our topic of discussion would be congenital dermal melanocytosis. Now, in this congenital dermal melanocytosis, as I already told you previously, these are also called as Mongolian spots. What are these called as? These are also called as Mongolian spots. And what is the second important thing? What is the second important thing is that you have to describe them. Now, is it really important to describe them? Yes, because in the questions, they instead of giving the picture, if they give you the picture, it would be easy to diagnose, but they will depict this spot, whatever is there, right? How are they going to depict? First of all, you should know any rash you take, guys, in dermatology or anywhere, whatever it might be, any subject, any rash which you see, first thing you have to look at the rash and tell whether the rash is elevated or flat. Here the rash is flat, first thing, right? So the first thing, can I write it as, it is a flat rash, flat rash. And next, tell the color. What is the color? It is little bit bluish and grayish color, right? So it is bluish gray, bluish gray patch, bluish gray patch. Third important thing you have to tell is the location. So where do you find these? These are most commonly seen in infants, and infants, where is the location? So these are most commonly seen in the infants, and within these infants, where is the location, guys? The location is in the lower back. Okay, the location is in the lower back of the lumbar area. Lower back, or called as lumbar area. Right? Fourth important thing, if you want to remember, it is your wish, but it is not that important for your exams, that this congenital dermal melanocytosis is most commonly seen in Asians and Hispanics, right? So most commonly, this is most commonly seen in which group of people, guys? It is seen in Asians and Hispanics. Asians and Hispanics, right? So this is all you need to know, and obviously this is not a permanent rash. Obviously this rash resolves spontaneously within 1 to 2 weeks. Okay, nothing to worry. So these are some of the normal findings in the newborn. Okay.